Hi, welcome to our Speaking of Women's Health series on menopause, a how-to survival guide video series. Now, menopause is something that many women don't speak out loud about very often, but there are many ways to cope with and treat menopause, and that's why we're dedicating this video series to addressing women's most frequently asked questions and concerns. Today we're with Dr. Holly Thacker, Director of the Cleveland Clinic Center for Specialized Women's Health, and one of the nation's foremost leaders in women's health. Dr. Thacker, why would a woman develop osteoporosis in menopause, and what exactly is osteoporosis?
Well, osteoporosis is brittle bones. Adults should not break bones when they fall from a standing position. It is not a normal part of aging. And over 1 in every 2 women over age 50 develops osteoporosis. And it's in large part because of the lack of estrogen that happens at midlife. When you don't have enough estrogen, the bones break down so much faster than they build up, and consequently there's a net loss.
So menopause is the time in a woman's life when she should definitely get tested for osteoporosis.
It's a great time to get a baseline bone density, to go over your family history, your lifestyle, what medications you're on, and what you can do to be strong, be healthy, and be in charge.
And that's what we all want. So let's say you are a menopausal woman. What kind of treatment would you prescribe?
We always start with lifestyle. Exercise, good nutrition, calcium, and vitamin D. Those are the building blocks. But for a lot of women, while it's necessary, it's not sufficient. So if you're rapidly losing bone, all the exercise and milk and vitamin D in the world will not stop that. So many women, especially those with osteoporosis, those who've broken bones, those who have a lot of risk factors, need prescription therapy. And we have so many different safe, effective options to prevent bone loss, to build bone, and to reduce broken bones.
So doctor, at the onset of menopause, when you might be developing osteoporosis, what would be the signs that you might, would you feel joint pain?
Actually, there are no symptoms of osteoporosis by and large until you break a bone. Then the cat's out of the barn.
Yeah.
So you might have joint pain that can be from low vitamin D or arthritis or other conditions. So that might bring a woman to the doctor. But you really have to be vigilant. And that's why we want the family history, the bone density, and the hormone assessment.
Doctor, I've heard a lot of talk about vitamin D. And is that important for women when they are in menopause?
Vitamin D is very important for all people, men, women, children. It's integral to bone health. Vitamin D helps us absorb calcium. Vitamin D actually helps us in our balance and reduces falling. So I think that many adults, particularly those with osteoporosis concerns, should ask their physician for a 25-hydroxy vitamin D test.
That's great information for everyone. Thank you, doctor. For more nationally leading insights on women's health from Cleveland Clinic doctors, please log on to speakingofwomenshealth.com. And while you're there, sign up for the Speaking of Women's Health e-newsletter. It's free and it offers a lot more great advice and guidance.